Dr. Reilly, if you're walking along with young people long enough, there's going to come a time when someone reports to you, a child reaches out to you, or you yourself are concerned about that child reaching a point in their struggle where they are contemplating suicide or moving towards suicide. And I know you've told us that the youth minister is not supposed to take on the responsibility of doing a clinical assessment.
Mm-hmm.
But there is some judgment that has to be exercised about whether we're going to reach out for help or make a referral or talk to the parents. What kind of things should the youth minister be looking for, thinking about to make that judgment?
Sure. I think when working with kids, it's important to have a set of almost guiding questions that help you understand, is this someone who's acutely in crisis, or is this someone who's struggling, certainly, but for whom aggressive or acute treatment is not needed? I think generally one of the things that we like to look at is, how is the child functioning in his or her environment? When a teen is able to stay connected with school, stay connected with friends, have communication with family members or someone else who's in the support network, those are still indicators that while there might be some anxiety, there might be some sadness, there's enough skill there. There's a level of functioning that merits perhaps some individual work, but it's not to a crisis point. So I would want to think to myself, is this child still functioning in the areas where he or she is supposed to be functioning? I think when we start thinking about, is this bumping up to a higher level of crisis, is when we start seeing pretty significant changes in personality. And not just, a change in hairstyle or, maybe looking a little different one day, but something that's radical and more consistent. And that change is impacting the child's life, so perhaps more isolation. I think a warning sign for me, for sure, is withdrawing from communication and connection in different activities. In terms of what makes it even more significant is if the child's actively talking about death or about suicide. And I think we need to take all expressions of suicide seriously. And to me, once that topic is broached, I think that really makes me think about, I need to figure out how an assessment can happen. Children or teens who have actually attempted suicide before are by far at increased risk. So if we know that history is happening and we're seeing changes happening as well, to me that merits right away an assessment to find out what's going on. I think if someone is telling me that he or she has a plan or has thought about it enough to think of what they would use to hurt him or herself, or thinking about things like, I'm going to do it in the afternoon right at 4 o'clock because I know for sure nobody will be there and nobody's expected at home until like 6 o'clock. All of those things to me indicate that there's a level of forethought, of planning, of having had enough time to really orchestrate what's going to happen, and that really warrants an assessment immediately.